Metabolic syndrome. What is it and how can it be reversed? I'm Dr. Rawat, a physician with over 25 years of experience as a family doctor, studied nutrition at Harvard, founded the website healthgroupcoaching.com, and is currently writing a book titled Slow Aging, Reverse Disease, and Optimize Weight. So perhaps your physician has told you that you have metabolic syndrome, or perhaps you are heading towards metabolic syndrome. What exactly is metabolic syndrome, and is it possible to reverse metabolic syndrome? That's what we'll be covering on this video. The diagnostic criteria for metabolic syndrome is having any three of the following risk factors. So in a man, having a waist circumference, which would be a measurement of your waist at the largest point, which typically is a few inches above your belly button, of 40 inches or more. In a female, 35 inches or more. Having a triglyceride level of more than 1.7 millimoles per liter, or taking medication for that. Having a high density lipoprotein or good cholesterol HDL level of less than 1 in a man or less than 1.3 in a woman, or taking medication for low HDL, and or having a blood pressure which is above 130 for systolic, above 85 for diastolic, or taking medication for blood pressure. So note that out of these 4 features, you only need to have 3 to have the diagnostic criteria for metabolic syndrome. So on my coaching program, I do talk about the thrifty genotype hypothesis and the personal fat threshold. So you may well be someone who has a stronger genetic predisposition to having metabolic syndrome despite not being particularly overweight. So just the triglyceride, HDL, and blood pressure may be enough to diagnose you with that despite not being particularly overweight. Of course, those clients who have a stronger genetic tendency to develop metabolic syndrome will often be skinny fat, which means they don't look particularly overweight on the outside, but they do have more truncal or visceral fat, which means fat around the belly button, which means fat around the waist, around the belt. And these clients will often be at increased risk of metabolic syndrome, despite often having a normal BMI or body mass index. So what does metabolic syndrome say about your risk of developing cardiovascular disease going forwards? Well, bear in mind, cardiovascular disease, which means having blockages in blood vessels supplying your organs. For the heart, that could be a heart attack. For the brain, that would be a stroke. It could also be erectile dysfunction, gangrenes, and peripheral vascular disease, essentially increasing the risk of blood vessel disease forwards in life. And of course, remember that this is the most common cause of death in the Western world, followed by cancer, and then followed by neurodegenerative diseases such as Alzheimer's and Parkinson's. So if you are at increased risk of developing metabolic syndrome, or if you know someone else who is at an increased risk, then taking steps to minimize the progression, or if possible even reverse metabolic syndrome, will definitely go some way in reducing your risk of premature mortality and premature morbidity. Of course, we do have effective medication to minimize your risk, as well as supplements, which I do discuss on my website within the product recommendation section. However, taking all these medications and supplements can often improve your lifespan, but they don't always have so much of an impact on your health span, or the number of years you'll be spending experiencing healthy, disease-free. And so we definitely cannot discount the importance of lifestyle, nutrition, exercise in reducing our risk of metabolic syndrome, particularly if you have been identified as someone who is at risk of developing cardiovascular disease. So while genetics does play a role in this, and it can make a person more susceptible to developing cardiometabolic disease, and this would happen at a younger age and at a lower BMI, the primary factor, however, is your lifestyle, diet, and environmental factors, which you can change. As an example, this study of Japanese ethnicity clients compared those who lived in Japan versus who lived in North America, and found significantly higher rates of metabolic syndrome in those Japanese ethnicity clients who were living in North America because of the Western style diet relative to an Eastern style diet that those who were still back in Japan were having. Now, there will be people who will say, well, if I have a Western lifestyle and dietary pattern and I become morbidly obese, then I can just get onto Ozempic so I can reduce my weight. And I would say to that unfortunately, you are trapped within that Western kind of a food lobby trap followed by a Western pharma lobby trap. That would not be a permanent solution. You will be making the big food lobbies a lot of money by consuming their products and gaining a lot of weight. And then once you get onto pharma drugs such as Ozempic to lose your weight, you will make them trillions of dollars as well. However, that will not be a permanent solution. It has been shown that 60 to 70% of weight returns almost straight away on stopping drugs like Ozempic. And if you want a permanent, long-lasting, sustainable solution to this, you will have to adopt a more Eastern lifestyle and dietary pattern to counter that Western lifestyle and dietary pattern problem that you have. Of course, if you are morbidly obese, then there is a role of drugs such as semaglutide, Ozempic, Wegovy, Mounjaro, etc. However, this has to be paired with a lifestyle and dietary change. And that's what we're talking about on this video, along with many other videos on this channel. This is a study which demonstrated a significant reduction in features of metabolic syndrome in those clients who followed a Mediterranean style diet, and that is one of the best studied and most scientifically validated diet patterns to reduce features of metabolic syndrome. We must remember, however, that when we talk about a Mediterranean style diet, we don't mean just the food or diet pattern itself. It's also a lifestyle pattern. Those people were more active, they walked more steps, they were more social, they would be more relaxed and chill about things. They would sit in the evening next to the fire or next to the sunset and talk and socialize. They had purpose in their lives, and they probably got enough exercise, enough sleep. And of course, there was this particular diet pattern, but they were eating more whole foods. They were also consuming more quality foods. And it's an overall diet pattern along with a lifestyle pattern which ensured better health outcomes. If we look at the research done in the blue zones, for example, one thing you'll notice is that these are more traditional areas where they live more traditional Eastern style diets, even though two of those zones are in the West. One more thing I would like to point out here is that these people were mostly coastal and they had a higher intake of fish and other kinds of food items with more omega-3. And I feel that is also a common factor that all of these blue zones, where they had a significant number of centenarians or people who would live till age 100. So one of the best dietary and lifestyle patterns which has been researched for longevity. And it's not all about restricting yourself or not enjoying yourself. There are foods which are fairly enjoyable, which in fact have been shown to reduce incidence of metabolic syndrome. And I'll give you two examples now. Dark chocolate, for example, has been shown to reduce the risk of cardiometabolic disorders. Cocoa plant has many benefits, and as long as it contains much more dark chocolate, and personally I buy a 90% cocoa dark chocolate, which ensures that you have less added sugars and other kinds of products which dilute the effects of the cocoa, it is quite beneficial. So excellent snack. Bear in mind, of course, that chocolate is a high calorie density food item, and by and large, the most important factor for your health is your energy balance. Even if you eat healthy, if you eat excessive number of calories, and don't burn them off and end up storing more energy in the form of body fat, then you will still find yourself in a not so good metabolic situation. So even if dark chocolate and red wine have some health benefits, you need to ensure that you are keeping your dietary intake within a calorie deficit or calorie balance if you're already in a good place. Red wine as well has been shown to reduce the risk of metabolic syndrome, and this is deemed to be due to antioxidants and plant polyphenols such as resveratrol. Generally speaking, the darker the color of a plant-based food, the more health benefits it has, the more polyphenols, flavonoids, antioxidants it'll contain. So some examples would be red potatoes have more health benefits than white potatoes, and sweet potatoes have the most health benefits. A red cabbage would have more polyphenols than a white cabbage. Red wine has more of the same effects of red grapes than white wine does. Even with beer, a bitter like Guinness would have more health benefits than a distilled beer like Stella, for example. And so, generally speaking, if you have to make a choice between these food items, go for the ones with a darker color, because you're more likely to get more of those polyphenols, flavonoids, antioxidants within that food. There are many people who blame carbs for developing insulin resistance and metabolic syndrome. It's important to understand that carbs are not all bad. In fact, certain types of carbs are extremely beneficial for metabolic health, and these would be in particular whole intact grains and fruits. However, in certain forms, particularly refined and liquid fructose, carbs can be quite detrimental for metabolic syndrome. And so these would be those food items which are derived from fruits. However, they are not original fruits in the original form. The water, fiber has been taken away. A lot of the antioxidants and flavonoids are no longer in these long storage and factory made food items. And in that kind of a rapidly absorbing form, which is metabolized primarily through the liver, fructose can be detrimental for metabolic health. And that would be primarily fruit juices, fruit jams, marmalades, ice creams, all kinds of factory-made items which are containing fructose. And these could also be high fructose corn syrup containing foods which have typically a long storage life. So look out for those kinds of foods because they are detrimental for metabolic health. It is very important to emphasize, however, that fruits in their original form are the opposite. They are extremely healthy for metabolic health. On my coaching program, I recommend a circadian type of lifestyle where I do recommend more fruits in their original whole form and whole intact grains like brown rice, steel-cut oats, millets, sourdough bread with flax seeds, for example, for breakfast and also for lunch. But I do recommend a low carb or even zero carb high protein meal last thing, which would be 14 hours before your breakfast. And this would be to allow less sugar to be present in your bloodstream late in the day, allowing you to burn more fat overnight. I would urge you to watch my previous videos on reversal of fatty liver, reversal of prediabetes, and an ultimate intermittent fasting plan to understand that concept in more detail. In this review article, there is talk about how excessive intake of refined processed fructose can also increase uric acid or gout levels, which can also increase risk of cardiometabolic syndrome. Of course, other factors which can increase gout levels or uric acid levels include being obese, eating excessive mammalian proteins, as well as being dehydrated or not having enough of a fluid intake in the context of a genetic predilection to excreting less uric acid as well. It is important to point out that chronic increased uric acid levels in the bloodstream not only increase risk of painful conditions like kidney stones, gallstones, and gouty arthritis, but are also a risk factor for cardiometabolic disease later in life. Is there a certain dietary pattern which can reduce the progression of metabolic syndrome or even reverse metabolic syndrome? This has been studied in a randomized controlled trial, which I'll be sharing very soon. It is a very detailed study, so I won't go into too much detail. But do remember that there are some basic concepts that you need to understand, which are perhaps even more important than the kind of dietary pattern that you follow. Those basic concepts are that if you have a genetic tendency towards developing cardiometabolic disease or metabolic syndrome, then you need to, regardless of where you are, lose belly fat. You need to increase the amount of muscle in your body. You likely need to enter into a calorific deficit, and healthy ways of doing that would be a combination of moving to a more whole food diet and also some degree of mild intermittent fasting in a circadian hormonal kind of a pattern. So primarily eating early when you're active and burning those calories, and avoiding eating late when you're more likely to be inactive and storing all of those calories. This is the study in question, the LIPE gene study, in which they had 4 groups and they divided them into 4 different type of diets and followed them for 12 weeks. They were measuring their cholesterol, inflammatory markers, and also markers of insulin resistance such as HOMA-IR. They demonstrated that clients who had more intake of 2 particular types of food groups, so more intake of unsaturated fats, which would be omega-3 in the form of fish, olives, avocados, nuts and seeds, as well as increased intake of complex carbohydrates, which would be whole and intact grains such as brown rice, steel-cut oats, quinoa, millets, etc. These groups had a reduction in insulin resistance. I would urge you to watch my previous video in which I talk about dietary swaps to be made in order to reduce bad cholesterol, and these kinds of strategies are discussed in more detail on that video. Of course, increasing exercise is also incredibly important to reduce metabolic syndrome and insulin resistance, and this has been demonstrated in a study. In this study, it was demonstrated that those clients who were physically active with metabolic syndrome had a much lower risk of developing heart disease than other clients who had metabolic syndrome but were not physically active. We recommend a minimum of 150 minutes of brisk exercise per week. Of course, bear in mind that is a minimum. I would not urge anyone to be shooting for a minimum if they want to reverse metabolic disease. I would urge you to watch my video on reversal of prediabetes for more detail on how to exercise. Personally, I coach on 3 particular strategies. One is a strategy of exercise snack. So I, for example, 3 to 4 times a day would do 30 crunches, 30 squats, 30 push-ups and 10 pull-ups before meals. And I would do that probably 4 to 5 days in a week. On the other days, I would do some significant cardio as well. In my case, I like to play tennis with my 15-year-old son who plays competitive tennis. Yesterday, we played for 2 hours singles, and I'll probably play today as well. Today is Sunday. That's something we do on weekends, but I do more of the exercise on the weekdays because that's something I can do even in my office. I also tend to talk about resistance training, going to the gym and trying to increase muscle mass. That is also incredibly important. On the previous video in which I talked about reversal of prediabetes, there was a study I talk about in more detail there, which showed that a combination of cardio as well as doing resistance training is required for best results. Just relying solely on cardio or solely on resistance training doesn't give as good results as having a healthy balance of both. So to summarize again, what is metabolic syndrome? If you have 3 out of these 4 features, then you have metabolic syndrome. That would be a maximum waist circumference of 40 inches or more in a male, 35 inches or more in a female, triglyceride above 1.7, HDL less than 1.0 in a man or 1.3 in a female, blood pressure of 130 by 85 or more. You have metabolic syndrome if you have 3 out of these 4 features. And what would be your top 5 steps to reverse metabolic syndrome? Number 1 would be you need to lose belly fat, and this can be achieved through achieving some degree of calorific restriction. The best way to achieve this would be to follow a whole food diet and also some degree of restriction within meal timings. So early time restricted feeding, where you focus on eating early, not eating late. And I do discuss the science behind this in more detail on my video titled Reversal of Fatty Liver. Step number 2 would be to increase your muscle mass, and this would be primarily through resistance training, but there is a significant role of cardio as well. So combining both cardio as well as resistance training, consider exercise snacks, consider a step counter and aim for more than 10,000 steps per day. This will also go a long way towards not just reducing metabolic syndrome insulin resistance, but also reducing a risk of heart disease going forwards. Number 3 would be making certain types of food swaps. So identifying sources of saturated fat and replacing those with unsaturated fats, identifying refined processed sugars and replacing those with complex, whole, intact carbohydrates. And there is much more detail on the exact swaps to make on my previous video titled How to Reduce Cholesterol. Number 4 would be being particularly mindful of certain types of foods which are particularly damaging for metabolic syndrome, such as refined, processed, and liquid fructose. And this could be fruit-derived, artificial, factory-made items such as fruit juice, fruit jam, fruit marmalade, fruit ice cream, etc. And also being mindful of foods which contain high amounts of saturated fats. These are all foods which are damaging for metabolic syndrome, and you need to find healthy replacements for this. Equally, being mindful of the kinds of foods which are beneficial for you, and these include whole original fruits, green leafy vegetables, cruciferous vegetables, salads, and also certain types of pleasure foods like dark chocolate and red wine, in moderation of course. And number 5 would be introducing some time restriction to your eating pattern, some degree of circadian or hormonal fasting, early time restricted feeding, at least 4 to 5 days in a week where you are focusing more on eating early at a time when you're more active and burning those calories, and not eating late at a time where you're less active, and not just storing more energy, but also ensuring as a result having higher levels of circulating sugar in your bloodstream overnight, which then inhibits your fat burning overnight. Because ultimately the primary or central pathology which leads to metabolic syndrome and insulin resistance is excess accumulation of fat within the liver and the pancreas, as I do discuss on my coaching program when we discuss the personal fat threshold and research done by Professor Roy Taylor, which is discussed in more detail on my video, How to Reverse Prediabetes. And anything we do which allows our body to burn more visceral fat will be beneficial to reverse metabolic syndrome. I hope you found this video useful. Do remember to like it, leave a comment, and I'll personally reply to every comment. Share the video with anyone that you feel may find it useful. There are many people out there who have metabolic syndrome but don't realize that they have this syndrome, and that puts them at increased risk of heart disease going forward. So do share this video with those people so they can get their blood work done and get checked out. If you would like to join me one-to-one within a Zoom group session for coaching, I run a program which runs over 4 weeks, 8 classes, 8:30 p.m. Tuesdays and Thursdays on Zoom Eastern Time. We have a new batch starting next week, and I do this every alternate month. Over the program, I coach on 8 things. This is usually a 30-minute coaching session followed by a 30-minute Q&A session in which I answer all kinds of questions from members. The topics that we cover include causes of metabolic disease, obesity and how to reverse it, intermittent fasting, a whole food hyper-nutritious diet, an anti-inflammatory diet to slow the aging process, how to modulate our gut microbiome, how to manage sleep, stress, and how to improve exercise, the optimal kind of supplementation to reach our goals. And I do have a section on my website where I have product recommendations for all of these things, including omega-3, vitamin D, multivitamins, etc. And we also have a class in which we discuss how to prevent skin aging as well as management of menopause. If you don't feel inclined to spend any money on getting education, then there is a free option on the website where you will get recordings of these sessions. And at the minimum, subscribe to the YouTube channel, and I will be making sure I provide as much knowledge and information to you as possible. Take care, and I'll see you at the next video.